Welcome back. We're going to talk about how to heal COVID lung damage. Now, before I begin, I'm not replacing your medical care. This is my opinion. Check with your doctor before taking this advice, okay? There was an interesting study that showed that 50% of people with lung damage after being exposed to this COVID virus 3 months later showed no evidence of lung damage, which is pretty exciting. So apparently a good percentage of people with COVID that had lung damage tend to heal on their own, which is a very good thing. What you have to realize is the virus that invades your body when it goes into the lungs causes an immune reaction. It's the immune reaction that's causing the inflammation, not the virus. In other words, it's the byproducts of your immune system attacking the virus that's causing the inflammation, which is then leading to scar tissue. Now, there's going to be a point of limitation, no return if it's too advanced, but there are things you can do. The sooner you get to it, the better. But there are things that you can do to help speed up the process and repair some of this damage to your lungs. Number one, tocotrienols. What is tocotrienols? It's a type of vitamin E that works 50 times stronger than tocopherols. So you want to find a good brand that has just tocotrienols without anything else, okay? So you want to take 3 times a day, spread out through the day. Vitamin E is amazing to decrease the free radical damage and to reduce inflammation. It also works directly on the immune system. Number two, you want to take vitamin D. Vitamin D is probably the most important nutrient for viruses and lung infections and inflammation. It's a natural anti-inflammatory. It's not even a vitamin. It's like a hormone. And you want to take 40,000 IUs, international units, per day. It might seem like a lot, but it will help reduce inflammation. And that inflammation is what's leading to the scar tissue. So we want to avoid that. All right, number three, there's another product that I recommend. You're going to have to look it up. It's from a company called Standard Process, and it's called pneumotrophin PMG. Okay, I would take 6 of those, and I would spread it out through the entire day. That will greatly help your immune system. It's something I used to use when I was in practice, and it works great on lung problems. Number four, zinc. Okay, I would recommend 200 milligrams of zinc. Zinc is essential when you have viruses and when you have inflammation and when you have lung problems. And number five, do intermittent fasting and periodic prolonged fasting. Why? Because fasting strengthens your immune system. Fasting gets rid of scar tissue and unwanted damaged proteins in your body. But when I say prolonged fasting, I'm talking about at least 48 to 72 hours. If you do that every 2 weeks, you'll be in really good shape. Thanks for watching.